Thanks, Zoe. Now that that's all set, I want to thank you again and welcome you to today's webinar titled State Legislation for Suicide Prevention, Moving Beyond a Focus on School Personnel and Youth. And we've got some great speakers today that we're happy to have to be a part of our event. I want to note that there's a chat box on the left side of the screen there where you can chat in your questions or comments or anything along those lines while the presentation is going on. As a reminder, you will be getting all of the audio through your computer speakers today. And with that, I'm going to move us along here to the next part where Zoe is going to give you just a quick background on the tech for today's webinar in case you have any issues. And so with that, I'll turn it over to Zoe Baptista, who's doing the tech for us in the background. Zoe?
Hi. Just very quickly, if you're having any trouble joining the webinar or logging in, you can see the audio information is through your computer speakers, and if you need tech support, there's a number there, a couple of numbers there to call. You can also type any questions you have at any time into the chat box that Adam mentioned. It's in the lower left-hand side of your screen. And then you can also make the presentation itself larger if you'd like by clicking on the 4-arrow button, which is, I'm hovering this green arrow right over it. And you can click on that. Oops, sorry. You can click on that to hover over it, and then just click on it again, that little full screen button again if you want it to disappear. That's it. Back to Adam.
Thanks very much, Zoe. So just a little bit of background before we go into who we'll hear from today. This webinar is going to focus on statewide legislation pertaining to suicide prevention and about how you might get engaged in a process like that, how you might take part in some advocacy or promoting a particular issue, how you might get information about existing legislation, not just within your state, but across the country and other states that are working on issues that are similar to those you may be interested in. And so we want to make sure you're up to speed on what resources are out there and how you can actually take a role in this. So to do that, we invited along Trevor Summerfield, who's the Manager of Federal Policy at the American Foundation for Suicide Prevention, or AFSP. And then followed by his presentation, you'll hear from Peggy West, who's a Senior Advisor here at SPRC. And then I'll close us out with a quick review of some of the SPRC resources you can use to learn about legislation, activities happening in your state, and things along those lines. So I think that without further ado, I'm going to turn things over to Trevor. And if there's anything, Trevor, that you'd like to say as far as an introduction that I did not include, please do. And I'll move the slide to your first slide right here and turn it over to you. Go ahead, Trevor.
Wonderful, Adam. Thank you so much, and thank you, Zoe, for having us on the webinar today, and also for the great work you do over at the Suicide Prevention Resource Center. And welcome to everybody on the phone. Thank you for taking time out of your schedules to join us today. I'm stepping in just by way of background for my colleague, Nicole Gibson, who is far prettier than I am, I assure you. She does great work as our Senior Manager of State Advocacy and is a contact that we'll give out at the end of this presentation. And she'll be the main contact, at least in our office, for state advocacy. But I'm stepping in for her today to talk to you about active and effective advocacy, supporting policy change at the state and local level here within AFSP. So today, during this presentation, we're going to try to direct you on where to go to learn more about state suicide prevention plans, state suicide prevention funding, state laws on suicide prevention and mental health, how to track legislation that you care about or impacts your office or policy agendas, looking up your state elected officials, and also getting involved in state advocacy efforts through a variety of different sources, including here at AFSP. So starting with the state suicide prevention plans, which I'm sure many of those on the phone today are familiar with, there was a Surgeon General's call to action back in 1999 that prompted states to design their own strategic plans for preventing suicide. And then recently, back in 2012, there was the release of the new National Strategy for Suicide Prevention that has prompted many states to re-examine and amend those plans. Here at AFSP, we advocate for state plans that address suicide prevention across the lifespan, are implemented and evaluated, and are funded and sustainable. So really comprehensive plans that address all components of suicide prevention that we feel are important at the state level. And you can go to the AFSP website, and I believe Adam will share these at the end of the webinar as well. But under advocacy and public policy and under the state policy section, you can find many of the references I'll be making today in terms of what resources we have here available at AFSP. SAMHSA, the Substance Abuse and Mental Health Services Administration, also who we work very closely with, recommends that plans are data-driven and utilize the latest research, identify and prioritize high-risk populations, integrate and coordinate activities across multiple sectors and settings, address both risk and protective factors, and also incorporate a collaborative effort by multiple public and private organizations, and that's something we really stress here at AFSP. Our mantra is that we could all work 24 hours a day, 7 days a week, and still have more work to do. So it's best to work with partners in our communities, figure out what certain groups do well, and focus on those efforts, and as a team effort, really make a difference in preventing suicide back in your states. SAMHSA also recommends that the plans be based on a public health approach, which looks beyond a sole focus on treating individual characteristics and circumstances to a broader focus on risk and protective factors and populations, partnering across sectors and working across the spectrum of prevention, intervention, and postvention. Also, they like plans that utilize safe communication, incorporate monitoring over time for effectiveness, and this is something we do stress as well, that evaluation is very important to further improve plans and monitor to see how they're doing, and also promote accountability and be regularly updated and revised. And you can find more again on the samhsa.gov website under the grants section, and this will be shared later on as well for you to see. So if you're looking at where to find this information, where do you go? Where do you find your state suicide prevention plan? The SPRC website is wonderful, and they have information under states, materials, and plans where you can find your individual state suicide prevention plan. You can also find out who is in charge of implementing your state suicide prevention plan. These are important contacts for you to reach out to if you have any feedback or if they're seeking input to reach out to them. And you can also find detailed info by state on plan development and current suicide prevention activity available upon request here through our public policy team by emailing us at advocacy@afsp.org. We have plenty of resources here that we do on a state-by-state basis, and all you have to do is contact us, and we'll try to get that information to you as soon as we can. You can also, when you're looking at these plans, understand that funding is a really important component to look at as well, and sometimes a little harder to track down. But again, SPRC has done a great job in organizing these contacts as people you can reach out to and figure out what funding, if any, is going into your state plan. Contact plan leads again through the SPRC website. You can also contact us, as I just mentioned in the previous slide, by emailing advocacy@afsp.org, or you can search your current state budget for quote-unquote suicide prevention. Lots of state budgets and legislation, for that matter, are available in PDF formats, and don't be afraid to use that find feature. It's a great way to navigate through what are sometimes hundreds of pages of legislative text to really narrow down your search and see what's been allocated for suicide prevention funding. In a lot of states, the state suicide prevention activity and state positions have been primarily funded through grants, which are about 2 to 3 years on average. If those grants, however, are not renewed and expire, there is no guarantee that the activity will continue. So this is important to note, and it's also important to note that because that's why budget line items and dedicated state funding for suicide prevention activities are critical. If you're able to advocate for dedicated suicide prevention funding in your state that goes to the implementation of your state suicide prevention plan That's much better preferred than relying on a grant that may run out in 2 or 3 years, and we've certainly seen that happen in certain states. So looking at state laws, we do a lot of tracking here in our office, and we track laws and legislation in the following priority areas that annually we review, go through our Public Policy Council, and then are subsequently approved by our board of directors here at AFSP. But those areas that we're focusing on right now as priorities is suicide prevention in schools, and that includes training for school personnel, school policy and student education, bullying prevention, firearm safety, suicide prevention training for health professionals, mental health first aid, and the implementation of mental health parity laws at the state level. You can see issue briefs on all of these materials if, again, you go to afsp.org and under the Advocacy and Public Policy section, visit the state policy portion of the website. And again, details by state, real in-depth details that our team has done a fantastic job of putting together here are available upon a request by emailing us at advocacy@afsp.org. There's also, which will make it a lot easier to navigate, an interactive map that is currently in development where users are going to be able to click on a state and find this customized information with one click of a button, and that should be done actually sometime soon, so look forward to that. And this is just a quick example. This is a screenshot of our suicide prevention training for school personnel. It's not the entire page, but there's a lot of information there, as you can see. So visit that. You can click here to learn more at the bottom of that paragraph there. And also there are links to many PDF documents that provide detailed maps as well as other information by state on suicide prevention training for school personnel. Into tracking legislation, which sometimes can be a difficult task, but more and more, I mean, I remember when I started my career 10 years ago, tracking legislation at the state level was a chore, but more and more states have really updated and refined their process to help out folks looking for what they need, and this is really state by state now readily available. So go to your state legislature website, so insert your state here, legislature, it'll pop up, and generally you'll see, you know, legislation or tracking legislation or links to that where you can click on and go from there. You may have to create a user ID or login, but all of these sites are free. No state out there charges for you for the ability to track legislation, and this is really important because getting involved in the legislative process involves timeliness, and you need to know where to interject yourself at key points. So if there's an upcoming hearing, if there's a vote scheduled, as a bill's passed from one house to another, those are very important factors to note to insert yourself into the process and conversation. Of course, it's always good to reach out to committee members in states and get involved before anything's even introduced so you can take part in the legislative drafting process and also be more in the loop as bills and legislation moves through the process. Here's one example of a state legislature page out in Utah. This is one that does not require an ID, but you can see here some of the things on the page, which is pretty similar in most states. I mean, we picked this slide out because it really is an average kind of example of what most state legislature pages look like. You can enter bill numbers, enter sponsors' names, or even, again, a keyword subject like suicide prevention or mental health. And on the next slide here, this is just a quick example of something. This is down in Texas, but this is an example of a page that will require login information. Again, really easy to register. I think it's easier to register for these sites than like even Twitter or Facebook. All you got to do is provide an email address and password, and you're going to be good to go. And then everything will look kind of like that previous slide with Utah in terms of what you can search by bill number, again, legislative sponsor, or keyword searches. Now, how do you find your folks back home in the States? Because this can get tricky at times, much like at the federal level. But most legislature websites offer a tool to look up your elected officials. And most of them are based on, where your zip code is, your county or town and city. Lots of places you can just enter your full address and it'll pull it up. If you happen to know what state legislative district you're in, lots of sites also offer that opportunity to look up who is representing you. But for the most part, most people enter their home address and it pops right up. So that way you can know who to reach out to as a constituent. And again, to emphasize some of the state legislature websites, look at committee assignments as well, because there are other important people you want to reach out to, whether they serve on a Veterans Committee, a Health and Human Services Committee, et cetera, appropriations that you want to reach out to. It's an easy way to find them. There are also some other helpful websites out there, including openstates.org, govtrack.us, and the National Council for State Legislatures page at ncsl.org, and you can find a lot of information here. They're great resources and data tools to, again, stay informed and keep up to date on who your current legislature, who your legislators are. Here's another slide again on one example of how to look up your legislator. This is the North Carolina General Assembly website. And again, up in the top right corner there, you can click on that Who Represents Me button and enter some information and find out who your state legislator is, whether it's an assembly person, member of the House, or Senate, depending on how your state legislature is constructed. On this next slide here, we also have California. Again, it's in a little different spot, but you can see by looking at most of these web pages, it's pretty easy to identify. Just click on those buttons and it's really an easy process as long as you know where you live, which hopefully everybody does. It's really easy to figure out who represents you and who you need to reach out to. This is my favorite slide in this deck because we hear this often at our AFSP Advocacy and Policy Office. Of people who, are hesitant to get involved because they think it's, why do I want to get involved in politics? It's frustrating. I'm not going to make a difference. My voice won't be heard. There's too many other things going on. What can I do? But the thing we really do emphasize, and we've shown this with our track record here on legislation up in Capitol Hill and also back in the States, that your opinion does matter and you will make a difference with your elected officials. We really emphasize that our advocates maintain regular contact and build relationships with elected officials and their staff. And this really, time after time, the longer people have been involved with us and the longer they've been advocating, you start building these relationships, and that's really how you can make a difference at the end of the day. And you do that by sharing your personal story, asking them to support the issues you care about in a friendly way. They're not always going to support something, but maintain those relationships and be persistent and open those lines of communication, and it really does make a difference at the end of the day. And then also, especially for the folks on this phone call today, because you're so knowledgeable, offer to be a resource on suicide prevention and mental health that actually provides a great touch point for many legislative staff or congressional staff to reach out to if they have any kind of question on suicide prevention or mental health legislation. And it's really important to note that the combination of a clear and real message based on data, research, and personal experience conveyed effectively to elected officials is a winning one, and it really is. And that's a point that should be emphasized not only on this webinar, but to anybody that you talk to back in your states who wants to get involved. Speaking of getting involved, how do you do it? Call and email your elected officials regularly. If you call their office, lots of times you can get the staff person contact for that legislator that oftentimes is more accessible than speaking directly to the member themselves. And this is something that's a great tool time after time because it gives you a direct line of communication. You're not filling out some form email that gets lost in cyberspace, but you have that direct contact with the individual that's involved in making decisions there in that office. Engage your elected officials via social media. Twitter is a wonderful, wonderful tool. Share photos, commend them, often thank them, pat them on their back. They can't be thanked enough for the wonderful work that they're doing, and encourage them to support your efforts back at home. Also, sign up for newsletters. Most members will have on their personal webpage a place where you can sign up for emails, and also back to the previous comment about social media, places where you can, with one click, follow them on Facebook or Twitter or other social media apparatus. And then also visit your elected officials in person, whether it's on your own or if you want to join AFSP. We hold state capitol days in many states, and I know lots of other groups do as well. But this is really effective, especially, you know, if they're on recess or on break, and, you know, state elected officials are very accessible back home in their districts. But it's a great way, again, to kind of put a personal face on the issue, let them know why you care, and also let them know that you're there, and you're going to continue to push them to make the right decisions and choices and support suicide prevention and mental health back in your state. In addition to that, you can also form or join a state or county coalition on suicide prevention or mental health. Most states have some kind of statewide suicide prevention coalition that are doing great work, and they're also great people to reach out to because they're plugged in, again, to the communities throughout a state. So they may know even other local or county suicide prevention coalitions that are great to reach out to because they contain the folks who really, you know, this is on their mantle and this is their issue, and they're looking, you know, to address it just like you are. But they're a great resource. They're a wonderful resource to reach out to, and the quicker you can find out who's working on these issues and who you can collaborate with back in your states, the better off your advocacy efforts are going to be. You can also connect with community stakeholders and local reporters back home by visiting afsp.org/media, and also for reporting recommendations on suicide, reporting on suicide.org. This is something we routinely do if somebody's seen in a local publication or news outlet back home and a story about suicide that was reported either insensitively or there was language used that, you know, may encourage contagion, etc., that these are great outlines for media and reporters to follow, and it's a great resource and tool for them as well, and it's all part of the education process. Advocacy is not just about changing laws, it's about changing minds, and lots of times the most effective advocates are the ones that really are involved in the education process 24 hours a day, 7 days a week. Also at the local level, attend local meetings such as town halls, city council, local and school board meetings. These are places where your voice can be heard easily. It also makes a direct and oftentimes quicker impact. Certainly I know here with the great work our advocates do at the federal level, we've just seen some amazing and quick turnarounds with people that get involved with their local school boards or town halls, or town halls or city councils, because it's a direct pipeline into your communities. People know each other, and also they're much more agile in terms of turning around and making quicker decisions. Finally, you can join our Field Advocate program, which would encourage everybody on here to do by visiting our website again at afsp.org. And under Advocacy and Public Policy, you can click on Become an Advocate. It's a real quick, easy application that you can fill out. And one of the things we try to let people know is that, you know, we make it really easy for you to become involved in a field advocate. I know we get questions all the time from people that are concerned with their time constraints, and they may be pushed a little bit or worn thin, but we make it easy on them. We track the legislation for them. We send email alerts and updates. Every time we do, we include a template or talking point if we're asking them to reach out to their elected officials. We answer any questions they have or prep them for meetings and other events, and also connect them with local resources like AFSP chapters and other stakeholders in sports. And really, as I said before, the Field Advocate program, they build relationships with public officials and community leaders to increase awareness of suicide as a public health problem. They promote local, state, and federal policies, laws, and programs that promote mental health and prevent suicide, educate their community about suicide and mental illness, build partnerships with suicide prevention and mental health organizations, government agencies, local media, and other stakeholders, and recruit, and this is a very important point, to join the Suicide Prevention Advocacy Network, and that's a great thing. If you enjoy the advocacy program and you're an advocate yourself and you want more people to get involved, talk to them about it and get them to sign up. And that's it for me today. Here finally is some contact information, as I mentioned before, for Nicole Gibson and myself. There is a poll question out there that if Zoe could pull up would be great. One of the things we'd like to know is if back home in your state, and to conclude this presentation, we'll pop that up there right now. You can see it on your screen. If there is an identified legislative champion back in your state. And we'd love to, we do have contact information for everybody on the line, but whether there is or isn't, specifically if there is, we'd love to find out who that member is and share that information. Again, that's all part of our teamwork mantra here, working together, figuring out who the touch points and champions are, and then working with them, again, to make a difference. Even at the state level, there may be people passionate about suicide prevention or mental health, but as legislators, they carry a tremendous amount of weight, and we want to make sure that if they're interested, we're there to help, and also if they're really zealous about introducing something that is the best product that they can put forward. So with that, we're going to leave that up for a couple more seconds, but really thank you all today for joining us. I appreciate it, and if there's any questions at the end of the presentation, we'll be happy to answer them, and of course, you have our contact information on the screen, both for Nicole and I, and you can shoot us an email anytime or give us a call, and we'll be happy to talk further. Thank you so much.
Trevor, this is Adam. Thanks very much for that presentation, and thanks to everyone for doing the poll there. And I did want to say one thing related to the poll. If you did happen to say yes to the question if there's an identified legislative champion in your state, if you wouldn't mind typing who that person is in the chat on the left, that would be really great. We can kind of see if everyone knows who specifically they would be talking to, and that's, I think, would be helpful for everyone here to see.
That'd be great. Thank you, Adam.
Yeah, no problem, Trevor. So what we're going to do next is go to Peggy, who's going to try and ground some of the information that Trevor presented to us here with her example about developments and the experience from Washington State over the last couple of years. And before we move there, I'll ask for the poll to go away and for Zoe to swap over to Peggy's layout so we can see her photo. And then, Peggy, I will advance the next slide. So it's at the beginning of your presentation. Okay, Peggy, you can get ready to go ahead.
Thank you so much, Adam, Zoe, and Trevor. This is a great opportunity to share with all of you on the webinar what we've learned in Washington State and how it might help you move forward efforts in your state. Washington has had a youth suicide prevention plan for almost 20 years. However, moving beyond having a plan and having some grants to assuring a broad range of partners and assuring continuity of efforts is something that we have recently used legislation to move efforts forward. Now, you might wonder, the title we had for this was Moving Beyond Training for School Personnel, and the reason that's in there is I noticed from your registration that many of you work in states where you have had some training for school personnel required, and that's a wonderful accomplishment. We also have that in Washington State. However, there are many reasons why you would want to move beyond that and use that as a foundation for moving forward to working with other groups. We have had many awareness, gatekeeper, and screening programs for suicide prevention in states, many of them as part of Garrett Lee Smith grants. And all of these efforts suggest referral to mental health providers and or health providers for people who are identified at risk. Yet these professionals, more often than not, have had none or inadequate training in assessment, management, or treatment of suicide risk and ideation. School training typically also places emphasis on referral to mental health and health providers for youth who are identified at risk. And, of course, finding those providers who are trained is quite a big challenge in many areas. In addition, individuals with the greatest risk and numbers of suicide are not in school. School dropouts and adults are not in school, and especially men in the middle years, where we know the numbers of suicides that occur are the largest, cannot be reached through school programs and have often had no efforts in state plans that address how to reach them effectively. Providers in states are typically licensed and often, though not always, are required to take continuing education as part of their licensing requirements. In many states, the only content of continuing education that's required for mental health and health providers is professional ethics and HIV/AIDS. Apart from that, what is taken for continuing education is up to individual choice. Some states have more recently added some requirements for continuing education in pain management for physicians, and so that's been showing more movement in adding special topics, which often professionals are not eager to support. In Washington State, I want to tell you about our legislative history and then go through some of how we accomplished this, because it's something that you can do too, and as Trevor outlined, there are some resources at AFSP to help you, and also at the end of this, Adam will be talking about some SPRC resources that can help you. Health professionals in Washington State through House Bill 2315, which was enacted this year, are required to take continuing education in suicide assessment, management, and treatment. And this includes physicians, osteopathic physicians, nurses, including LPNs, RNs, and advanced practice nurses, physical therapists, physical therapy assistants, chiropractors, naturopaths, osteopathic physician assistants, and physician assistants. This is a one-time 6-hour requirement, and it, for some groups, will only be 3 hours when their main practice role is identification and referral. This law also required the state to develop a lifespan suicide prevention plan and to pilot a mental health consultation line for health providers focusing on adults, modeled after a line that exists in Washington State, which focuses on children. This law passed the House with 96 votes in favor, 2 against, and the Senate unanimously. So you can see in the end we had great support for this. This law built on and was an expansion of House Bill 2366, which was passed in 2011-12 legislative session, and this focused on mental health professionals and includes mental health counselors, social workers, chemical dependency professionals, occupational therapists, marriage and family therapists, certified counselors, and psychologists who are required to have continuing education training of 6 hours every 6 years, with the exception of some whose scope of practice is only screening and referral, and they're required to have 3 hours of training. This law passed both houses in Washington State unanimously. You can find complete information and text of the laws on the Washington State legislative website. And I think Trevor covered well how important it is to go to websites and use what's there that you can easily get access to. Washington State's legislative website, in addition to what Trevor shared with you, includes videos of all the hearings. So you can actually watch testimony. You can see how people presented their arguments both for and against the legislation. And I think this is very helpful if you're wanting to anticipate what might happen in your work with working on passing legislation. Also, you can see drafts and the complete documents as well as the votes that were taken. Here's a picture of Washington passing the legislation and the governor signing it. You can see this is just a small representation of the many stakeholders who worked to get this legislation passed. And the two children with their mother there are the suicide survivor advocate who led the effort, Jennifer Stuber, who's on the faculty at the University of Washington, who lost her husband to suicide 3 years ago. The bill passed in 2012 is named for her late husband, Matt Adler. So what are the keys to success? How did we get this to happen? I have to admit, when this all first started several years ago, many of us were skeptical that in one legislative session this could be moved forward, and anticipated working on this for far longer than it ended up taking. Survivor stories were, of course, a key to getting the legislation passed, and especially survivor stories where the survivors were able to speak directly to the content of the specific legislation and how providers having training might have made a difference. The survivors who spoke in testifying to get this legislation passed included an attempt survivor who had an experience with a health provider where medication management had been handled in a way that put this individual at greater risk. A health provider who works in the VA who testified about the extent to which he and his colleagues had been prepared to address suicide. A spouse survivor, that was Jennifer Stuber, and a parent survivor. In addition, we had a surprise story shared from a legislator, and I'll tell you about that a little later. It was also important to have a survivor champion who coaches and works with other survivors to help them craft their stories. As you may know, when you testify to the legislature, you only have somewhere between 1 and 3 minutes to tell your story. And so each person who talks has to come very prepared, and having someone who's a survivor champion who can help other survivors put their story together in a way that they can tell it under the pressure and time constraints of the legislature is really important. It's also important to have a legislative champion. Some of you have indicated you know who your legislator is, who can help, and this is really important to work with this person. In Washington State, Tina Orwell, who also happens to be a social worker, worked tirelessly to make our legislative efforts move forward. The legislative champion has to be able to reach out to legislative members from all parties. This is certainly something that affects people from any political persuasion, and the legislator being able to have good relationships with everyone is very important. Tina Orwell participated in stakeholder meetings with all interested parties to answer questions, sharing drafts of the legislation, and answering questions that lobbying groups had, including some that were not very in favor of the legislation. In addition, meeting with lobbyists from interest groups and opposition and talking through what can be done to make the legislation more appealing to them, as well as helping them understand why it's important. This involves a lot of time for a legislator, and we're very fortunate in Washington that Tina Orwell was willing to do all of these things. Stakeholders and partners, as Trevor mentioned, are extremely important. Here's a list of some of the stakeholders and partners that worked with Washington's effort in the two legislative successes I've been mentioning to you. And you can see this is pretty broad. One of the groups that I would say made probably the biggest difference in getting the legislature to pass these two bills unanimously were veterans groups. We have a lot of military installations and a lot of veterans in the state of Washington, and the veterans groups were very concerned about suicide affecting their members, and we had multiple veterans groups come and testify, submit testimony, come to stakeholder meetings, including some that I frankly had never heard about. So if you are going to work towards this in your state, be sure and contact your veterans groups. They pointed out to all of us that 75% of veterans get their care in the same places all of us do. Only about 25% of veterans get their care through the VA. So they felt that what happens in the healthcare and mental health systems in the state to make it able to deal with veterans effectively is extremely important. Media coverage is also important, and in Washington State we had excellent cooperation from the media in terms of letting people know that this issue was being addressed by the legislature and what some of the concerns were. I've listed here links to a couple of examples of what went in the media. Jennifer Stuber was very good at writing a guest editorial in the Times. We have a new organization in Washington State called Forefront, which is a cross-departmental collaboration at the University of Washington. Their newsletter had publicity about what was happening. In addition, we also got good coverage from a daytime TV talk show that was a local one, a number of radio interviews with survivors, and but also a number of local small newspapers that were very effective in getting this story out to their local communities. We also had a Suicide Prevention Lobby Day. This was a collaborative effort. It included NAMI, the Washington State chapter, the Youth Suicide Prevention Program in the state, representatives from AFSP, and Forefront, and reached many legislators with, it was an opportunity to meet with legislators, talk to the media, and for survivors' voices to be heard by their representatives and others. Here's a flyer that was used for getting the word out about Suicide Prevention Lobby Day that was disseminated broadly and recruited a lot of people to drive to Olympia. Washington's capital is in Olympia, which is about 60 miles from the population center in Seattle, and requires people to take considerable amount of time out of their day to participate. And there's a link here to more information about the Suicide Prevention Lobby Day. I'd certainly recommend, if you are entertaining passing legislation in your state, to get a group of people together to form a lobby day. I'd say one of the most important things that moved this all forward was what I'd call persistence with resistance. Of course, there's always resistance from somewhere with legislation. You often don't know where it's coming from, but it's very important to persist in the face of it and to talk with people about the concerns. There was resistance in Washington from a number of groups with both pieces of legislation, especially the one recently passed this year from professional associations who didn't want to be told what to take for continuing education and had many arguments of they shared with the legislature. It was interesting to watch. Some of the arguments were not believed by the legislature, and it appears that the lobbyists are well known in state legislatures, and there's a lot of dialogue that went back and forth between the lobbyists and the committee people about the objections they had. Being able to compromise. In 2012, there was an attempt to include health providers in the legislation. There wasn't time to fully address the concerns and work on compromises, so they were taken out of the legislation, and groups returned in 2014 to revisit adding health providers to the group of professionals required to have continuing education with success. There were many meetings of the stakeholder group. Those were held in Seattle at the University of Washington School of Social Work, and at some of the meetings there were as many as 60 people, faculty, lobbying groups, professional groups, and there was a lot of interesting dialogue of people who'd never met face-to-face about the legislation and the opportunities that would happen with new training. And then sharing historical lessons was important. One of the things that we were able to share was that often there is resistance from professional groups and has been for legislation that's passed requiring professionals how to practice their profession. And in face of this, legislatures have passed laws, and we now take those for granted. An example is newborn screening, where initially there was resistance and opposition from medical lobbying groups, and today nobody would want to be without it. Unexpected support. We had a legislator who spontaneously shared her personal story about losing her husband to suicide and how she felt that if his physician had had more understanding of what to do in his situation, he might be alive today. This was a state senator who was actually on the Senate committee that heard the legislation before it moved to the full Senate. Nobody knew she was going to speak about this. I think often you find support where you don't know you're going to have it. We had a Veterans Administration family practice doc who, at his own expense, flew from Spokane to Seattle and came to Olympia to testify and talked about how in the family practice at the VA in Spokane, not only himself but other physicians had had no training in how to deal with identifying people at risk for suicide. And also this same year there was legislation passed totally unrelated to suicide prevention, focusing on integration of behavioral health and primary care, which was helpful. And we had groups of people from concerned with firearm deaths who also were willing to talk about the preponderance of firearm suicide deaths and their support for the legislation. So here's just some ideas of how you can use what Washington has learned in your stories. And I guess the biggest thing is be sure people show up in numbers to testify and are prepared and submit written testimony as well as verbal, and sharing the credit for success and build on the experience of others and believe you can do it. Thank you for participating, and I look forward to hearing your stories in the future and what you're able to do in your states.
Peggy, it's Adam. Thanks very much for your presentation there. And I also really liked how you tied into a lot of things that Trevor had mentioned in his previous presentation as well. So I'm going to do a quick bit next. So Zoe, if you could flip over to my presentation, please. I'll move us ahead. There's Peggy's contact information if you need that, and it's also available for me and elsewhere on the SPRC site. So I wanted to, before we go to questions, just tie in how SPRC can support your efforts. I know Trevor talked about what kind of resources are out there as far as legislative pages and information, and then how AFSP can support you with the resources they have, as well as their field advocate program. And I know many of you may be state suicide prevention coordinators on the line here today. So I wanted to just remind everyone that, as Trevor pointed out, the state pages on the SPRC website are a great place to go. If you're working with stakeholders and there may be people in your state that you come in contact with that want to be involved or learn more, say look through your state plan, figure out maybe what issue in there may be something that they want to be engaged in. So these are the places we want to put this information out. There's materials there. That's where you'd put your updated state plan. Organizations, those may be areas people may want to add their organization to as you become involved if you're trying to push policy or legislation. Maybe a place where you can go or direct people to gather more support for any policies or issues that you're looking to promote. And then also below, the recent developments and legislation part, and I'm going to flip to the next slide so you can see Washington's. I just blew it up in a screenshot here, but you can see a little bit of the history of their legislative developments, and each page has something like this, a short summary, letting folks know what's coming down or what's come up in previous years with regard to suicide prevention legislation. And this won't have, I know Trevor mentioned some resources coming out too that has an in-depth look at the type of legislation emerging from other states. You can see it, I think he said it was going to be a one-click stop on a map. So here on the state page you get a taste, and so there's kind of two places where you can get this information at varying levels of depth. So push this forward. If you have questions about the state page, you can contact your prevention specialist, and they can help you update those things, add information, things like that. You should also have the tools to do that. We have a little guide on how to make some edits yourself, I believe. So I think what we'll do is move to questions. If you have questions for Peggy or Trevor or myself even, please feel free to put them in the chat, and I'll read them out and direct them to the correct presenter. So I'm going to give you a second to go ahead and type. I see Linda's typing right now, so we'll give her a chance to finish that, and I'll read it out. Oh, and thanks to those of you, too, that typed in your legislative champion. I see some of you are in key positions to be in a role like that, or for promoting and speaking with legislators yourselves. So that's great. We'll save that information. I see Teresa is also typing. I think the typing has ceased. Oh, we got Linda back. Teresa has submitted a question here. She said, we are just embarking on legislative efforts for mental health required continuing ed. We would really like mentorship as we start/move through this process. Now, I think that's a great idea. As other folks continue on that road, even within this presentation, you can be guides to each other. And I think that's a great place to think about how you can use the AFSP and SPRC resources and see who's working on what from which state. I think a map, like what Trevor pointed out, would be great for figuring out who might be someone you could work with as a peer or mentor. I don't know, Trevor, did you have any other thoughts on that particular comment?
Yeah, absolutely. And Teresa, thank you for not only the question, but the great work that you do out in the state of Wyoming. we actually have a congressional spouse group here at AFSP, and Bobby Barrasso out there, who's the spouse of Senator John Barrasso, is one of the co-chairs. So I know they held their conference, I believe, on Tuesday this week. And just thanks for all their efforts out there and what they're doing to prevent suicide. In terms of mentorship, we'd be happy to help here, and I think Peggy as well, having went through the Washington State experience. And to Adam's point on, sharing of information, we have all of this stuff here. I know SPRC has materials as well. There's no shame in taking some ideas, models, or templates from other states and working with some of those folks and kind of getting an idea of some of the challenges they faced and how they were ultimately successful. But of course here, as I mentioned in our presentation, we're here, we think of ourselves, anybody that gets in touch with us, whether you're an advocate or looking for information, we're your staff on that front and would be happy to provide some mentorship or guidance as you go through the process.
Thanks, Trevor. I see the question that Linda had typed in is directed at Peggy. Peggy, I'll read it out for you. It says, Peggy, please talk more about how you address professional organizations' objections to mandating CE training, and are there other areas recently besides CE that has been the focus of legislation for suicide prevention? So you can take on those in either order. Go ahead, Peggy.
Okay, I'll start with the second part because that helped the first question. Two of the things that we took on that are in legislation, the first piece of legislation in 2012 also mandated the State Department of Health to do a study looking at what professions needed suicide prevention education and how much training they got in training programs that were within the state of Washington. And that there was money allocated and a bid went out, and the School of Nursing at the University of Washington got the contract to do that study, and that study is available through the Washington Department of Health website. I'd suggest you get hold of that and look at that, and it essentially countered the argument that people had, the physicians and nurses had, that they got a lot of training on suicide prevention, because this study showed that, in fact, in Washington State, people didn't have much, if any, training on suicide prevention. So that was one way the argument was countered, was actually having that study done and having that information. In addition, that study, the people who got the contract, Elaine Walsh at the School of Nursing at the University of Washington, and her colleague Carol Hoven went out and met with the professional boards that the Department of Health maintains, who oversee the licensing requirements for every profession. They went around and met with every single professional board and took their questions and talked about suicide prevention, and they got a lot of support from the board about the need for this, including some that hadn't even been included in the legislation, where people saw this as a need. In terms of the strongest objections for the second part of the legislation in this last year came from lobbying groups for the Washington State Medical Association and several of the nursing associations, and they were objecting to cost, and also they were objecting to being told what to take. And these arguments were countered by looking at the total number of credit hours they're required to take for continuing education, and what's required for suicide prevention is just a very small portion of the total hours they're required. And in fact, several of the legislators commented that they didn't understand why they were so worried about being told to have 6 hours of suicide prevention training when they had all these other hours that were still open to them for anything they wanted to take. In addition, in terms of the cost, it was pointed out that because continuing education is required, there's cost associated no matter what the content is. I thought the legislators in Washington State were very good about how they listened to the arguments and how they themselves sometimes countered the arguments, which others of us did not have to counter because the legislators themselves pointed out that the argument just didn't make sense to them. So I think credit your legislators with being used to listening to arguments carefully and not necessarily being swayed. One of the pieces of feedback we got was that the legislators liked hearing about newborn screening and the fact that this had initially been opposed by medical group, lobbying groups, and in fact, as chance would have it, there was a modification to the newborn screening law which came to the hearing just before the suicide prevention. And of course, there was no opposition now after 50 years, but they're still fine-tuning how this works to make it as effective as possible. And the legislators understood that sometimes people are opposed to something new that's in the public interest, and that the training doesn't, and what's enacted doesn't have to be perfect the first time around. It can be addressed, and here newborn screening is still being worked on to make it better 50 years later.
Great, thanks, Peggy, and thanks, Linda, to you for the question. I see that Pat's typed one in, and I'm going to go ahead and read it out, but I think maybe Trevor might have a comment on it. Does anyone have experience or lessons learned from working on county/parish or the municipal level? I don't know of any in Iowa, but we have some county-level groups that may be interested in beginning. Maybe similar to states, but we're curious of their areas of difference. So if any of the other states out there want to comment on that via chat, please go ahead. But Trevor, I think maybe perhaps you might have something to weigh in with on this one with the field advocates and things of that nature.
Yeah, thanks, Adam, and thank you, Pat, for that question. That's very good and ties into a lot of what I talked about during the presentation. There isn't much of a difference, to be honest, but at a local kind of county level, there may be other targets of focus. Where I'm from, up in New York State, they have county governments, and then of course, as I gave during my presentation, town halls or city governments or town governments, local school boards, they just may be more effective targets for your advocacy efforts. The one tip I do have in coalition is that coalition work can be tricky, and when you're getting things off the ground, it is really good to work with like-minded individuals, but also ones that share, at least what we've seen is effective coalitions. Kind of our mantra again, that collaboration is the key to success. Working with other groups that aren't going to impede your progress and want to work together with you and any other interested parties. But that's a great question, and that's a great action step to be taken at the local level, and I wish you the best. And again, if you have any more questions as you go through the process out there in Iowa, please let us know and we'll be happy to help.
Thanks, Trevor. Yeah, so it sounds like, from what you're saying, that the same principles of calling, emailing, contacting them, getting in their ear, they apply across, but instead of it being a state level decision maker, you may need to look in a slightly different place to see who that person, who that ear is.
Local, state, federal. I mean, the one thing that I've been really proud of our advocacy program here is that we really you can boil down stuff and apply it across the board with subtle nuances here and there. But even if you're, excuse me, I'm still getting over a nasty sickness that I had last week, starting to lose my voice a bit. But you can work with the folks across the board, and with subtle nuance, all the same kind of principles apply. And even if it's not on suicide prevention or mental health, if you're advocating for another issue, whatever it may be, I think those are the real key kind of advocacy 101 steps you have to take to be successful.
This is Peggy. I'd like to add a couple of examples from the county level. Thanks for asking the question, Pat, and Trevor for helping to focus on it. In some states, health departments, public health departments are independent at the county or local or municipal level. In Washington State, they are, and the county health departments in a number of counties in Washington have child death review groups that review all unexplained child deaths, including suicides. And recently in King County, they started reviewing them not by date of death, but by manner of death. So this year they had 2 actual review sessions, which looked at all the suicide deaths of youth in the county and worked on developing recommendations that would focus on potential for public policy and programs that might reduce the deaths based on what was learned from looking in depth at all of these deaths. And in addition, in King County, there have been efforts of means restriction focusing on both firearms and prescription painkiller drugs, and ways that the county can move forward to help reduce all deaths, which of course includes suicides, from those 2 areas of high risk.
Great, thank you, Peggy. Does anyone else have any questions for any of the 3 of us? You can go ahead and type them in. And if not, that's okay too, but I'll give it another minute here. All right, well, I'm seeing no action on the chat typing front. So Peggy and Trevor, if you don't have any other points to bring up before we wrap things up, I think we'll call it for the day. Do you guys have anything else you wanted to mention before we go?
Nothing other, again, than thanking you all so much for having us on here. It was a real pleasure. And thanking for everybody that was taking time out of their schedule to attend this webinar today. Again, if you have any questions, email us at advocacy@afsp.org.
Thanks,
I want to thank Trevor for participating and filling in for Nicole, and please pass on to her. We're delighted that this is something we can work together on, and I look forward to hearing everyone's stories of success.
Thanks, Peggy. So before I wrap it up, I just wanted to say thanks also, and that we will be doing a short evaluation for today's webinar. So you'll be getting an email about that as a participant, and I thank you very much ahead of time for filling that out. It helps us improve our future offerings. This webinar is going to be archived and posted on the SPRC site, so you can send it along to any of your other constituents or colleagues that didn't get to participate today. And I'll also send a notification about the archived copy being available via the listservs, the same avenues with which you got the invite for this webinar. And besides that, as Trevor mentioned earlier, I'm going to put together a list of the links, and it'll go out with that so that even the folks who did not get to listen in live will get the resource links that were mentioned throughout the presentation today. Thanks to you all again very much for participating, and that ends our webinar for today. Thanks to Zoe for the great tech support in the back end, and have a great rest of the day, everyone. Take care.
The meeting is now over. All the participants have been disconnected.